Good afternoon, everyone. This is Saro Arakilians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on the medications news and update. So today I want to touch base on the measles outbreak that you have probably heard of as a few days ago. So the Texas Department of State Health Services is reporting an outbreak of measles in the South Plains regions of Texas. At this time, there is about 198 cases, or probably more, that have been identified, and this has started spreading from January of 2025. There has been 23 of the patients that have been hospitalized because of measles. There has been one fatality in a school-age child who lived in the outbreak area. So this is a very serious outbreak that affects adults and children. Due to the highly contagious nature of the disease, additional cases are likely to occur in the outbreak area of the communities, especially in that area. As people travel from Texas, also there could be a bigger spread of measles in this part of the country. DSHS, or Department of State Health Services, is working with the local health departments to investigate the outbreak and the origins of it. The best way to prevent getting sick is to be immunized with 2 doses of vaccines against measles, which is primarily administered as combination of measles, mumps, rubella vaccine. So if you haven't received your vaccinations, it's time to check with your provider and get the vaccine. 2 doses of MMR, or measles, mumps, rubella vaccines, are highly effective at preventing measles. Even as the hospitals in the area offer free testing and vaccination, the growing outbreak shows the challenge healthcare providers face in stopping the spread, as it could be contagious from human to human, and it could spread very fast and unknowingly. CDC recommends that people get MMR vaccine, or measles, mumps, rubella vaccine, to protect against measles, mumps, and rubella. Children should get 2 doses of MMR vaccine, starting the first dose at 12 to 15 months of age, and the second dose at 4 to 6 years of age. Teens and adults should also be able to date on their have to be up to date on their MMR vaccination. Two MMR vaccines are available for use in the United States. One is MMR2 and one is Priorix, as you may have heard of it. MMR2 and Priorix are fully interchangeable for all indications for which MMR vaccination is indicated or recommended. Children may also get the MMRV vaccine, which protects against measles, mumps, rubella, and varicella, which is chickenpox. So there is a combination of vaccine of MMR, and there is combination of MMRV, which is includes also for vaccine for varicella or chickenpox. This vaccine is only licensed for use in children who are 12 months through 12 years of age. So again, this is a summary about the measles outbreak that you've heard probably from Texas. Already 23 patients or more are hospitalized. There has been a fatality in a school-age child in the Texas area. The Texas Department of State Health Services is working with local agencies and as well as with CDC to make sure all the patients affected in the area the outbreak is investigated, and the outbreak is able to be stopped somehow, some way. Again, the CDC recommends the best way of fighting against the spread of measles, mumps, measles outbreak is getting the measles, mumps, rubella vaccine, or measles, mumps, rubella, or MMR2 or Priorix vaccine. And as I mentioned, there is another one for children 12 months and through 12 years of age. called MMRV, which is measles, mumps, rubella, and varicella, which is chickenpox. So, regardless of which vaccine you get, they're interchangeable. Make sure to contact your provider, and if you're eligible as an adult or for your children, make sure to get the vaccination to make sure you're immunized against measles. Hope you enjoyed this video. Make sure to comment on the video. Make sure to give your likes if you like the video, and ask your questions on the comments so I can answer any of your questions about measles. Hope you enjoyed this video. As always, stay safe and take your medications.